At this time of year, when employers inform their staffers about their 2026 health insurance benefit options and cost, comes a new national report from the Aon research firm indicating that workers will see a 5% increase in health insurance plan cost, and for their employers, a nearly 10% jump, some of the largest in years. And unfortunately, there may be more such increases to come in the future as the $1 trillion over a decade Medicaid cuts plan passed by Congress with Republican points about fraud and waste in that shared federal-state system start to take effect in 2027. It's especially bad for New York State, which has one of the most generous benefits and coverage Medicaid plans in the country, and for our hospital systems, which depend on Medicaid revenue and use it at even lower rates to help pay for emergency room and general treatment for all people, regardless of insurance coverage.
I think it's between 90 and 150 billion dollars over the course of 10 years. Now that's across the state. New York or Erie County is about, 3 or 4% of that total, but it's still several billion dollars of lost revenue. It's going to take a multifaceted approach for these hospitals to stay solvent.
So to make that up, Zelensky predicts they're going to turn to private pay and employee-employer subsidized commercial insurance to help recover lost funding.
So what you're doing if you're a big health system is you're going to payers like Highmark, Independent Health, Univera, and saying, hey, we're experiencing these Medicaid cutbacks. We've got to request higher rates from you. It's going to have impacts on us as taxpayers and as private health insurance premium payers.
We got this response from one health plan insurer, Univera, acknowledging such hospital requests and higher future health insurance premiums and the greater need to control cost for affordability. Now, the New York Health Plan Association, which represents our local Highmark and independent health insurance plans, agrees hospital associations are going to use cost shifting to commercial health plans to offset Medicaid cuts with higher costs for employers and us as consumers. Also, confirmation of that from the Healthcare Association of New York State, which actually represents hospitals. On your side, Ron Plants, Channel 2 News.